We all follow with great concerns the development of the novel coronavirus crisis worldwide. This week, the WHO declared a pandemic and expects a global population infection rate of around 70%. This is affecting different parts of the world at different rates and at different times and with different responses. However, in many countries, there is already a shortage of emergency drugs like adrenaline, antibiotics, and especially protective suits, gowns, and masks. I receive reports from many countries all over the world describing war-like conditions. For these reasons, elective routine procedures have been banned in these countries in order to reduce the consumption of essential resources and keep them accessible for emergency cases only. This may or may not be impacting your own practice at present, but we can all be thinking about what we can do as plastic surgeons and responsible doctors to limit this global crisis as soon as possible. First of all, we can learn from the experience of the affected countries and our colleagues and follow general WHO recommendations for pandemic containment and to protect our workforce and patients from unnecessary risks. This includes taking familiar hygiene measures and avoiding social contacts, of course, but we may also consider remote consultations where they are possible, postponing routine or non-urgent checks, or postponing operations and procedures wherever advisable. These are sensitive areas for our specialty. But we need to contribute to keeping important medication available for emergency patients. In particular, we may need to consider which operations in our discipline are associated with high resource consumption and which materials are more important for emergency treatments. I'm thinking in particular of procedures that require antibiotics, adrenaline for liposuction, for example, or protective gauze. Furthermore, we should consider that an asymptomatic patient can become a complicated patient through general anesthesia just by intubation, and that any major surgery may involve complications that may require inpatient treatment or even require intensive care beds. I'm talking to you from Germany, a country whose health system is considered one of the best in the world. And even here, there are already shortages in many places, and we are only just beginning to see the spread of the virus here. You will all have different current experiences in different parts of the world. But there is no doubt now that we will be all affected in some way and need to support our healthcare systems to operate effectively. As ISAPS members, we all want to make our contribution to patient safety worldwide. Even though you may not be severely affected in your region, this is an opportunity for us to come together as a community to support each other through and eventually overcome the corona crisis. In the meantime, please be assured that we as a society will continue to serve our members proactively. The knock-on effects on global travel and on convention planning is being felt worldwide too. Many of you will have had travel bans imposed, potentially have arranged leave for meetings that you can no longer attend, and or be canceling your own meetings, as ISAPS has had to for the coming months. We want to assure you that we will be looking at all the ways in which we can continue to support our ongoing learning and community engagement remotely, as well as making use of the materials available to you on our website. Please keep watch for our communications as we will provide you with additional resources in the coming weeks until we can reassume business as usual for our face-to-face meetings and educational events. Finally, we want to assure you that we are still planning ahead to be together in Vienna in September for our 50th anniversary World Congress. We will also make additional provisions in case any part of the world should remain under travel ban for members to join selected areas of the Congress remotely. I hope to see you all there in Vienna. Please stay safe and healthy.